So, hello everyone. Thank you all for joining today. It's my pleasure to welcome you to this PQI Innovation webinar titled Key Findings from the Speak Up Champion Evaluation Report. My name is Kaylee Vitek, and I will be operating the Zoom logistics of this webinar and introducing our speakers. When I'm not providing tech support for PQI, I'm a project manager for the Massachusetts State Perinatal Quality Collaborative. And you'll see Massachusetts featured in these results, and we're very proud to have over 500 Speak Up champions. Before I turn it over to Deborah and Renee, I want to highlight a couple upcoming PQI events. The next slide, please. So coming up on October 17th is the next PQI Innovation webinar. This is a free webinar titled Labor and Birth in People with Excess Adiposity, Implications for Clinical Care. And the speaker will be Nicole Carlson. I'll provide a link to register for that webinar in the chat shortly. Next in October is the next National Quality Improvement Essentials Conference. This is a full-day conference from 10 a.m. to 4 p.m. Where you'll learn everything you need to know to implement a perinatal quality improvement project. So again, I'll add the registration link to the chat in just a moment. And then rounding out 2024, we have the next National Speak Up Champions Conference. It is 8 hours over 2 days, so November 15th and 22nd, 2024, from 9:30 a.m. to 1:30 p.m. Eastern Time. And again, I'll share the link for that in just a moment. Next slide. And then we also want to highlight some education available on the PQI website. The first being the Speak Up Implicit and Explicit Racial Bias modules. There are 3 available in a bundle titled Why Everyone Must Speak Up, Pledging to Speak Up, and How to Speak Up. So if you've taken a Speak Up course and not taken the modules yet, definitely take advantage of this resource. And if you haven't taken a Speak Up course yet, these still provide a really wonderful foundation for the course, and you will learn a lot. Next slide. And then new modules to the PQI website are the birth equity modules. We had a webinar previewing these modules earlier in the spring, and that webinar is available on the PQI website if you'd like to learn more about them. Next slide, please. Wonderful. So before I turn it over to our speakers, I have a couple of housekeeping items. This webinar is being recorded and will be posted for free on the PQI website. We will have time for question and answer at the end of the presentation, so please type any questions you have into the chat and we will address them during that time. And if you experience any technical issues, please feel free to send me a private message and I'll do my best to help. Now it is my pleasure to introduce today's speakers. Renée Byfield is the Program Director, co-author, national faculty, and a birth equity coach with the Institute for Perinatal Quality Improvement. She is a clinical leader specializing in obstetric and newborn care, and she has diverse experience in nursing leadership, management, and teaching. Ms. Byfield's leadership in quality improvement, program implementation, and development of comprehensive, innovative educational programs testifies to her robust capacity for spearheading transformative change in maternal healthcare practices. We also have Dr. Deborah Bingham, who is the Chief Executive Officer for the Institute for Perinatal Quality Improvement, PQI, a perinatal consultant, and a retired Associate Professor of Healthcare Quality and Safety from the University of Maryland School of Nursing. Deborah Bingham is working to expand the utilization of implementation science and improvement science theories, frameworks, methods, and tools in an effort to eliminate preventable perinatal morbidity and mortality and eliminate perinatal racial disparities. And now I will turn it over to Dr. Bingham. So thank you all for listening, and we hope you enjoy this webinar.
Yeah, we're so glad to be here with you all today and so excited to go over the key findings from the Speak Up Champion course evaluation. And just one more housekeeping thing is we don't have any conflict of interest to report to you. These slides are owned by the Institute for Perinatal Quality Improvement, so all rights are reserved. And if you want to reach out to us for anything, including permission to use any of the slides, please email us at info@perinatalqi.org. And just want to point out that we have our mission at the Institute for Perinatal Quality Improvement is how we make all of our decisions. Everything we do at the Institute for Perinatal Quality Improvement, we ask ourselves, does that meet our mission or not? And that mission is to expand the use of improvement science and quality improvement to eliminate preventable perinatal morbidity and mortality, and to end perinatal and ethnic disparities. So we're really excited to go over the results of our evaluation for our Speak Up Champion course. Those of you that are not familiar with the Speak Up program, it is based on the Speak Up acronym and mnemonic. And this acronym and mnemonic is on our website, and Kaylee just put a link to it in the chat. And it is based on the word speaking, that's to speak up, right? So it's set limits, practice and prepare, express your concerns, apologize, keep improving, uncover and learn, and persuade others. The course evaluation that we will be talking about is again based on this acronym and mnemonic that is incorporated throughout all of our courses. We look at the work of eliminating disparities and ensuring equitable care as a journey, not a sprint. I'm on my journey. I have not reached my destination or my evolution in this regard yet, and each one of you are on your own journeys as well. Again, it's not a matter of like one and done, check the box, and too often that's how it's approached in our different organizations. So we've created an entire pathway, and what we're going to be focusing in on our evaluation results are for boxes, the red boxes, steps 1, 2, and 3. That includes the course and then also some of the other activities related and taught during the Speak Up Champion course. And we do have other courses. We have the ambassador course, which is the next level. These results are not about that course. The third option is then to become faculty. And so again, we are focusing our presentation today. Our data is focused on steps 1, 2, and 3. Now, just a little background. Actually, I'll turn it over to Renee for the do you want me to go over this, Renee?
I can definitely go through this. Hi, everyone. So glad that you're here. I'm sorry I was a little tardy, but a little background on why we did this is that, you know, we all know that in the United States, disparities in perinatal outcomes continue to persist. So disproportionately affecting Black, non-Hispanic, and Indigenous communities. And these disparities are preventable. And we always go through that data in every course. So data shows that these disparities in outcomes are due to racism and not the social construct of race. Next slide, please.
Whoops, sorry.
No worries. Implicit and explicit biases are unconscious and conscious attitudes or stereotypes that can affect how health professionals interact with their patients. These biases can significantly influence behaviors and decision-making in clinical settings. For example, studies show that healthcare providers may unconsciously give less attention to certain patients to make different treatment recommendations based on race, gender, or socioeconomic status, as we've gone through in the course. This differential treatment contributes to inequities in health outcomes, particularly for marginalized groups as it affects the quality of care they receive. So addressing these biases is crucial for achieving equitable health care for all. Next slide. So in spite of growing awareness of biases in healthcare, effective debiasing strategies have yet to be clearly identified and implemented successfully. And this is the impetus behind what we do in the courses and also our evaluation of this course. So although many initiatives aim to reduce implicit and explicit biases, the evidence on what truly works remains limited. This is a complex issue, as biases are often deeply ingrained and operate unconsciously. Next slide, please. So our study aimed to assess the key differences in learners' knowledge, attitudes, awareness, and actions towards mitigating racism in perinatal care. And we specifically looked at the changes before and after participants attended the Speak Up Champion Racial Bias Education course, which is the first course in the Speak Up Live education. We also evaluated learner satisfaction. Next slide, please. So PQI offers an 8-hour virtual and in-person Speak Up Champion course focusing on implicit and explicit racial bias education. And in the image, you'll see us conducting a national course in Texas in February 24, earlier this year. So this course is structured around the Speak Up acronym and mnemonic that Deborah went through, alongside quality improvement methodology. The course covers data and historical summaries, curated videos, interactive discussions, reflection time, knowledge sharing, role-playing exercises, and development of SMARTY goals. And if you remember, SMARTY stands for specific, measurable, attainable, realistic, time-bound, as well as inclusive and equitable. And also the accomplishment of making quality improvement action plans. Next slide, please. To effectively evaluate racial biases in perinatal health care, a comprehensive analytic framework is essential, and this is ours. This is a framework we utilized, focusing on the stair steps of knowledge, awareness, attitudes, behavior, and achieving equity. So the first step being knowledge. We assess the existing knowledge of perinatal health professionals about racial disparities. And then beyond knowledge, the awareness step evaluates professionals' awareness of their own biases. The next step, attitude, examines the healthcare providers' attitude towards racial equity and their readiness to implement change. Behaviors focuses on whether the learner applied what they learned. In other words, enacting behavioral change. And then the last step, equity, is to determine whether equity is achieved. However, I must say one of our limitations is that assessing equity was beyond the scope of this research study. I want you to also focus on the image in that and note that each step has underpinning strategies or foundational pillars that guide and support this pathway, ensuring that it is both actionable and adaptable to various contexts, while promoting continuous learning and improvement throughout the evaluation process. Next slide, please. So this table shows the characteristics of the respondents. These surveys were administered at different stages. So if you'll notice in the second column top, the pre-survey, which was conducted before the course, had 1,303 participants. Let's go then to the third column top, which shows us the post-survey after the course, had 772 participants. And then the third column, it shows the National Implementation Survey, and the acronym that we use there is, or the abbreviation is IMP survey, had 48 participants. So the data was collected from 28 Speak Up Champion courses held at both the state and national levels, between years 2021 and 2023. And the National Implementation Survey was conducted over a period from August to October 2023, allowing for a comprehensive evaluation across different stages of the educational intervention. It is also notable that 53.8% reported having completed implicit bias education in the past 3 years. Next slide, please. So this is we're just showing the overall table 2 that had the survey results. Now, over the next couple slides, Deborah is going to talk about the key findings and just kind of piecing apart what we're seeing in these results. So Deborah, I'll hand it over to you.
Thanks, Renee. And just to summarize what Renee just went over, recap, is we conducted 3 surveys. One was the pre-education survey, the pre-champion course. That's the 8-hour live, virtual, or in-person course. So that's their pre-education survey, post-education survey, and then we sent a survey out to people who had completed this course with at least 6 months previously, and some as much as 2 years previously, 2 to 6 months. And then we also did some qualitative analysis of the pre and post survey fill in the blank responses. And we have also conducted an interview that has a separate theme analysis that was a sub-analysis, qualitative analysis. Those data are not going to be presented today on this webinar, the qualitative analysis of the interviews. We'll save that for another time. And just want to note that our research protocol was reviewed by Pearl IRB and was found to be exempt from human subject. There was no human subjects research participants in this regard because it was an evaluation and survey methods. So let me go over, we have 3 key findings that I'm going to discuss with you today. And the first key finding is very exciting in that it is showing that, as Renee pointed out, our evaluation framework is around knowledge, attitudes, and awareness are the first 3 steps in our framework. And we found that our champion course improved knowledge, attitudes, and awareness. And that is extremely exciting data to show. And I want to point out the percent improvements was very dramatic. So you can see that we went from 8.8% improvement up to as much as almost 42% improvement from before and after survey responses. Now let me go through a few of these specific areas. As key finding number 2 is that the learners, despite what Renee just pointed out, 53.8%, as she said, had previously taken an implicit, explicit racial bias course prior to attending our course, 3 years prior to attending our course, within 3 years of our course. So it was striking to us that despite having more than half of these learners having taken a course within the 3 years prior to our course, how many misconceptions still exist on some really key facts, and facts that affect how we take care of people. So one of the first ones I'm going to point out, one of the key is around knowledge. This one was 86.2% did strongly agree that much of the racial disparity in maternal mortality in the US is due to racism. But we were shocked that it wasn't 100% strongly agree with this statement. And actually, we are still working on like, how could they leave our course and not have it be 100% at the end of our course as well? But again, we showed a huge improvement in this area, or at least some improvement in this area. So the next really big misconception that people have is the presence of implicit biases based on someone's skin color, not recognizing that as humans, we all have implicit biases, and skin color is one of those areas that we all have been indoctrinated around and have biases with. So we saw a big improvement here. 28 went from 28.8% to 54.1%. Again, we have these results are back from when we first started teaching, and we have made some adjustments. And so there is, because we saw these data earlier, and we have made even stronger adjustments to make sure by the end of our course, people do not leave with this misconception. But it just shows how ingrained these inaccurate, non-data-based, non-scientific concepts, notions, how perpetuated they are, and how hard and ingrained they are to change. The next one is around attitudes. The fact that race is not biology, it is not based in genetics or science. Again, we had only 57.3% agree or strongly agree with this statement. And we shifted that to 84.3% agree or strongly agree. And then racial categories were created and accepted by society to label people for economic or political gain. Again, that was an area that needed a lot of shifting in, and we improved that understanding in that area from 70.4% to 91.1%. And then I will say, sorry, back to the last statement, is I regularly see or hear situations where Black and or Indigenous individuals are treated with disrespect or worse during pregnancy. What had the biggest shift from 56.4% to 98.1%. So we're very proud of all of the improvements we saw in knowledge, awareness, and attitudes, and we recognize that we even want to do even better within our courses. But honestly, again, as Renee pointed out, we have not seen anyone who have shown as big a shifts as we have, or even had data to show how their courses are addressing these key issues. Our third key finding that we're going to be discussing today is that our courses we have data to show that it shifted people's behaviors. It's important to shift knowledge. It's important to shift awareness. It's important to shift attitudes, but that's not enough. How does that go to change behaviors? And so this was based on our implementation survey. Although we had a low N, we did have a lot of data from in the post survey as well as our implementation survey, and I'll go through both. This data right here on this slide is showing you the data from the implementation survey, showing that we had 95.8% of the people saying that the education led to them making and helped them make improvements in their work setting. We were also pleasantly surprised to see that 89.1% showed that it also improved in their social settings. And then we saw that the education helped them fully or partially implement their Speak Up Action Plan, 81.2% of respondents. And then each component, we asked about each of the components of the Speak Up acronym and mnemonic. And our responses went from 91.3% to 100% per item. And so these are really very exciting results. We also have our data from our post-implementation, our post-course survey, so our post-education survey. We had people write in what they plan to do post-education. And what they wrote in was centered around 6 key themes. These 6 themes were that they would use data and statistics to change the narrative. So that's huge. And many of them were, so a lot of our learners come from very different positions, some of which were the data people for their organizations. We had another key theme was further educate self and educate others about implicit biases. Listen and engage with patients and colleagues was theme number 3. And theme number 4 was stop conversations and defend, support perinatal patients so that they would speak up. Theme number 5 was to develop anti-racism statement and action within their organizations. And theme number 6 was to develop quality improvement initiatives. And here's a couple, 3 representative quotes of these types of behavior changes. First one is stop conversations that label a particular group. This is somebody's, that's what they're going to do. Another person, in my role, I will make sure all education reflects diverse and inclusive messages and images. Quote number 3, ensure that all staff use respectful terminology and avoid generalizations. So again, we don't have time to share all of the quotes, all of the data, but I will say that those 6 themes were very reassuring and very exciting to think about. One of the components of the Speak Up acronym is uncover and learn. And we actually in this question on the survey asked them to respond to these, whether they would be doing these specific activities. And it was it's very heartening as we look at these stark realities of inequities in our country that we had such a large percentage of people committing to doing these key actions. I'll just go through this. So 87.8% said they're going to take time to reflect on their own words and action related to race and ethnicity. Record the insights you gain about your biases in your Speak Up Reflections notebook. We had 77.6% say they're going to slow down in a situation and think about how their biases are affecting their assumptions and their actions, and consider obtaining more information or consider alternative explanations for what they are seeing before speaking and acting. We had 70.6% say they would evaluate the structures, processes, and outcomes from a social justice or racial equity lens. And we had 76% say they would ask people from different races and ethnicities than their own to help them uncover and learn about their own implicit biases. 67% said they would become friends with people from other races and ethnicities and ask them to help them gain more insights into the ways that racism affects them on a daily basis. And 74% said they would read books and articles on the Speak Up recommended reading list. So we had people leaving our course wanting to do more, wanting to learn more, willing to reflect, and to, which is a huge, I think a huge success. I'm going to turn it over to Renee.
Thank you, Deborah, and I'm glad to say we have more good news. A part of the evaluation, as I had spoken of earlier, was, how satisfied the learners were with the course. So as you see on the screen, you'll see a table, and I'm going to go through each of these elements in terms of the course satisfaction key findings. First of all, 98.8% strongly agreed that the education met their expectations. In terms of skills and knowledge from Speak Up training and whether their expectations are met, 96.8%, and you'll see the N on the top number. So that's 645 people agreed that it met the skills and knowledge from Speak Up training met their expectations. Then the next question was on a scale of 1 to 10. So likelihood to recommend this training to others, which the scores were majoritively greater than 8. We scored 94.1% of the respondents agreed with this over with a score of over 8. And then in terms of training was beneficial or highly beneficial for dismantling racism, 96.3% of the respondents agreed to this. So again, great news in terms of the satisfaction for this course. Next slide, please. So we're going to address some limitations because I want to just be transparent. First of all, the use of self-reported survey data, which has known limitations that include people providing invalid responses, right, due to social desirable biases. That is our first limitation. And then not everyone who completed a pre-survey completed the course and or completed the post-survey. And then the last limitation was that the implementation survey's respondent rate was low, and Deborah spoke of this earlier, with there being only 48 having responded to the implementation. Again, that third survey, the implementation survey, only 48 responded. And that was about 3.7% to 3.9% of the respondents out of the 1,223 to 1,313 emails that were sent. And these emails were sent 7 times. So we really did try to get as many as we could to fill out that implementation survey. And those emails were sent between September 2023 and December 2023. Next slide, please. And now for the conclusions. You've heard a lot of good news and we're very proud of the results. And just to sum everything up, first of all, perinatal health professional respondents self-reported that they had basic misperceptions related to the effects of race on perinatal outcomes. First of all, why racial categories of people exist, and Deborah mentioned this, and whether they personally have implicit biases based on the color of someone's skin. And as Deborah alluded to, because we watch our data and our survey responses, we've made adjustments to really hone in on them leaving with a full understanding of these concepts. There were also misconceptions existed, even though again, 53.8% of these respondents that had actually taken courses prior to coming to our course. That's over 50%, and they still had those misperceptions. So, you know, that was very notable to us, and we definitely wanted to make a difference in terms of once they leave our course, hopefully, you know, those misconceptions must be cleared up. Also, solutions for identifying and mitigating racial and ethnic biases of health professionals are needed. We believe that our program is part of the solution, but it must be multifaceted solutions. And then respondents who completed PQI's 8-hour Speak Up Champion course reported improvements in their knowledge and awareness of the effects of racial bias and racism on perinatal health outcomes, and self-awareness of their attitudes that are perpetuating racial disparities, as well as their behaviors. They made changes in their personal and professional settings. And if you are Speak Up champions, you have heard us talk about that sometimes it may just start with you first, right? So a lot of them were open and did admit to making personal changes as well as professional changes. Next slide, please. And we want to acknowledge our supporters with this work. First and foremost, we received financial support from Georgia Health Initiative, so we are very grateful. We want to thank our science team, and they're listed here, our researchers that also helped us with this, gather this data. Also, Illinois and Georgia leadership are also listed on this slide, and I'm not going to call all the names because they're listed. We had support from my librarian at Emory University, was very helpful. And then Pinquin and Massachusetts Department of Health, as well as Massachusetts AWHONN, who have been great supporters for PQI and Speak Up work. So thank you. If you're on the call, thank you so much for really helping this, helping support this work and to help it move forward. Next slide, please. And then more good news. This is some of our excerpts or testimonials from participants that have come to the Speak Up training. I'm going to read a few. It was phenomenal. Both Deborah and Renee were fantastic and engaging speakers even on Zoom. Thank you, which is hard to do. And the content was excellent. I do not have enough good things to say about this training. And that person was from Massachusetts. And then excellent conference with extremely knowledgeable and personable faculty. Participant from Tennessee sent that. It was amazing, eye-opening, and was a safe place. And these are representative. We have so many testimonials, but we picked out those that are more representative of what the general testimonials say. So just want to say that as well. And then this was extremely well done on such an important topic. Thank you. Every nurse, scrub tech, and physician should be required to take this training. And then I'll pick one more. Silence is complicit. Awareness is only the beginning. Moving to action will be key to improvement. I need to work on my mindset that being a white woman makes me less of an expert on these issues. I can arm myself with data to share. And that respondent was from Massachusetts. Next slide, please. And then some key takeaways that we often hear from participants are the following. Race is not a risk factor. Racism prevents women from getting quality perinatal care. Everyone has implicit biases. And then acknowledge the way that society has negatively impacted the health of people of color. Eye-opening history of race. Biases exist in us all. Biases cause bad outcomes, poor outcomes, and are preventable. And then everyone has implicit biases. Our implicit biases have the potential to contribute to people dying. We can become aware of and unlearn implicit biases, teach others about it, and work to save lives. And last but not least, I learned more background on race and the history of racism. I learned how to better implement quality improvement initiatives for racial disparities. And the next slide, please. I think at this point, we're going to take questions and comments. Or Deborah, did you have anything more to say before we open up for questions and comments?
I will. Oh, sorry. I will make one. One of the suggestions that we get the most of is that our courses, they want more time, not less time. So so that's really interesting, because we have people, administrators, who ask, can you do it in a less than 8 hours, right? But that is a question, and we say, but that's not what our data is showing. Our data is showing that we actually need more of these conversations, more time, and people are like, it's so packed. They would like to be another, have additional time. So we feel like the 8-hour course is really very essential, basic, foundational course to this. Anyway, let's open it up to questions. If you could type in your questions, that would be ideal. We are in a setting where if you would prefer to raise your hand and ask your question that way, that is also an option for you. So so I'd love to have you start to put in some questions for us about our evaluation data, or about our Speak Up program, our Speak Up course. Yeah. And while you're doing that, hopefully we get a lot of questions coming in, and you can chat it to everyone. That would be great. I will also mention that one of the unique components of our course, which I think really does help people leave feeling empowered. You see that entire list of things that people want to do. That's people don't leave feeling like, oh, this problem is insurmountable. It's that we can solve this together, and I will play my part in making things better. And Karen, thank you for coming today. Nice to have you here. Your question is, will we be publishing these data? And yes, Renée is going to be the lead author of this paper, and we have a very solid draft that's going to be submitted pretty soon. So so we're very excited. We feel like these data do need to get published, partly for us to learn and for others to learn from what we've been doing, because we know that there's a lot of courses out there, but they're not created the same. And do you see Nicole's question, Renée?
I'm catching up with the chat. I was having some issues. If you could go ahead.
And then I'll go ahead and read it and let you respond. So Nicole says, great work. As you have indicated, improving clinical outcomes will take time. How do you manage stakeholder expectations and also secure continued funding for these very important initiatives?
Well, that is a question that we're dealing with different organizations that have different funding and different commitments. That is a question that we strategize with leaders about all the time. It's a great question, Nicole. And that's the thing, it's really building up to what is the goal for the organization, and if you want to accomplish this, who are your champions to really have this move forward in a way that's important. And that's the thing. The first thing is looking at your data by race and ethnicity and really helping to justify the need for these conversations. And also getting a cadre of many people involved with understanding how important initiatives like this are for every organization in order to improve the overall maternal mortality rates as well as morbidity rates. Like, what is your end goal? What is your gold star? What are you aiming for? But I think it's really important, number one, to see the climate in your institution and your environment, institutional environment, and ask yourselves, what are our goals? What are we aiming for? What is our data telling us about race and ethnicity? And is this a part of the strategy? And it's a very timely question, because I was recently looking at an article about changes that had been made in a particular state, and nothing was talked about in terms of where did race play in it? Why were these disparate? What is a total story? What is the whole story about why disparities exist? And I think that's part of, that picture that we have in our education where you don't want to see the data, you're scared of the data, you're not going to look at the data, you're going to ignore the data. And Deborah, please feel free to chime in. Hopefully I've answered that question.
I think that's always organizations have very tight budgets. I think it's really a challenge, like but I think your point of what's your value and what's your priority is really key. And is it okay that we leave a certain portion of our population behind and just say, oh, well, we can't fix those disparities? I don't think so. I think we're better than that, because I think as a country, we will only reach our full potential if we reach the full potential of everyone. So, and the data, like Renee was saying, is the data helps you make the case. And we have been suffering as a country and organizations from having data that shows us these disparities. And so it's time we also face those data and have better systems. And I know that our birth equity modules that we mentioned at the beginning is a really good start for helping get people on board for all of these conversations. And we've got Melinda Monroe and Kinsey Gatman, who both are saying they want to bring this education to their whole teams, and how does that work? And basically it's like any education, we offer conferences, and we offer both national and we offer both private events. And so we would love to meet with you separately to go over how to do that in your state, in your organizations. I think our data is answering a gap that there aren't a lot of good answers around what's working. And I think our analytic framework is groundbreaking. I haven't seen a lot of other programs that are carefully evaluating or publishing or even transparent about their data. They might be doing a lot of training, but we felt like we want to be completely transparent, that we want to be part of the solution. And I think our quality improvement approach is very unique. Is like people come in and you're expected to leave with an action plan. And so that's different than just coming and passively having people talk about the problem. It's actually coming up with solutions. So yeah, so please reach out to us. Kaylee, would you put in our info at perinatalqi.org email, just so everybody knows how to reach out to us and how to get in touch? Yeah, and I also, so if just to be clear, Renee, did you want to, before I go on, want to make sure if there's anything else you wanted to add, because there's a couple of other things I can add, but
no, that's okay. You can go ahead, Deborah.
Okay.
It's a great conversation.
Yeah, so one of the things in leading change is we have on our website a lot of resources. So feel free to go and look through our resources on our website. And one of those resources is what's called the ABCDEs of implementation strategies. And so if you're feeling a little stuck as far as like, how do I get people back engaged on this topic? I know there was a lot of interest immediately after George Floyd's murder, but then I've heard other people's like, well, aren't we done with that? I mean, no, we're not. We are just beginning this work, right? So helping lead these conversations of change, I think, is really critical. But just like trying to learn anything and shifting, it's a whole paradigm shift. This is a paradigm shift. This is not just a one and done. This needs to be equity needs to be part of all of our work, every QI initiative, And that won't happen if people still think that there's some scientific basis for race, right? So we've got to get some of these notions. We have to get people to know that there's a problem and that there is, and then changing attitudes and awareness. So those are the first steps. So anyway.
But you're so right, Deborah. You know, we've seen organizations begin these conversations and there's a lot of pushback. But persistence, 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 and there's a way of interweaving these conversations in subtle ways to get people to think and to be reflective and to really look at their environments. And that's what we talk about and we learn from each other in these courses. And we're very proud, like we said, of the results and what people are saying in terms of being able to go back to their organizations and feel that there's something that they can do and that they're not alone. So like Deborah said, this is not a one and done. We have a whole pathway of learning that engages you in going along this process of really trying to have sustainable change within your organizations. That's what I just wanted to add.
Yeah, and we've also had, like, there's been people who said, how did I become a women's health nurse practitioner? And I never knew, or an OBGYN. We've had both. More than one OBGYN said, how did I not ever hear about Marion Sims, right? And all of the atrocities that he perpetuated on and abuse of young women. So as slaves. So anyway, there's a lot we haven't been taught and there's a lot that we can do. So yeah. Any other questions before we close up today? Anything else you want to add, Renee?
No, that's it. Just very grateful all of you came. Thank you.
Yeah, and just to remind you as we close up today, we have upcoming events. These are, you want to learn more about other people's work. We highlight other people's work through the Institute for Perinatal Quality Improvement. So there's another free webinar coming up on October 17th. We feel that having quality improvement expertise helps us with addressing inequities as well as improving outcomes in general. So join us at that conference where we dig into spend a day doing QI together from an equity lens. And then and going over a lot of QI principles, setting goals, data tracking, and data analysis. And then we have our Speak Up Champion course in November. There's still space in that course. Early bird registration does end for both the QI Essentials course and the Speak Up Champion course. They both end very soon, actually this week. So sign up soon. And then some people that our results are not based on the modules. Our results are based on the 8-hour course that we just went over, but the modules supplement that 8-hour course, and also sometimes that's a place where people can begin. And then our new modules on equity modules, this is 4 modules that go over some key points. The first module is on crafting anti-racism statements. The second module is on enhanced data collection from using race ethnicity. The third module is on equitable debriefs, how to debrief from an equity lens. And then perinatal care standards is the 4th module in this course. So they're all together in this same course. It's interactive. And so those are, Renee's the lead author of this course with these 4 modules. So yeah, hopefully you join us in any one of these different learning activities. So
thank you.
Bye.
Bye. Thank you.
Bye.